Today, we're diving into a topic that's incredibly important but often overlooked: women's health. Ladies, let's face it. We're so used to juggling work, family, and everything in between that sometimes, our health takes a backseat. But here's the thing, your body is constantly talking to you. It sends subtle signals when something's not quite right, and learning to recognize these signs can make all the difference. That's why in today's video, we're talking about symptoms you should never ignore. These might seem small or harmless at first, but they could be signs of underlying health issues that need immediate attention. So, grab a cup of tea, sit back, and let's get started. First up, let's talk about persistent fatigue. Sure, we all feel tired from time to time, especially if you've been burning the candle at both ends. But if you're constantly feeling drained no matter how much you rest, it's worth digging deeper. Chronic fatigue can be a symptom of anemia, thyroid issues, or even more serious conditions like heart disease. If you notice this, don't just brush it off as being busy. A quick visit to your doctor for a blood test could uncover something treatable. Another symptom to watch out for is unexplained weight changes. Losing or gaining weight without any change in diet or exercise might seem like no big deal, but it could point to serious health problems. Sudden weight loss, for example, could be a sign of diabetes, hyperthyroidism, or even cancer. On the flip side, rapid weight gain could indicate hormonal imbalances like PCOS or thyroid disorders. Tracking your weight changes and discussing them with a healthcare professional can provide valuable insights. Next, let's talk about abdominal bloating. It's normal to feel a little bloated after a big meal or during your menstrual cycle, but persistent or severe bloating isn't something to ignore. It could be linked to gastrointestinal issues like IBS, food intolerances, or even ovarian cancer. If bloating is accompanied by other symptoms like changes in bowel habits or pelvic pain, get it checked out immediately. Speaking of pelvic pain, this is another symptom that often gets dismissed. Pelvic pain can be caused by a variety of issues, from endometriosis and fibroids to urinary tract infections. However, chronic or severe pelvic pain could also point to more serious conditions like ovarian cysts or pelvic inflammatory disease. If the pain persists or worsens, don't hesitate to seek medical advice. Now let's discuss changes in your menstrual cycle. Irregular periods, heavier than usual bleeding, or spotting between periods are all signs that something might be off. While occasional irregularities can be normal, consistent changes could indicate hormonal imbalances, uterine fibroids, or even early signs of menopause. If you're noticing unusual changes, keeping a menstrual diary can help your doctor identify patterns and potential causes. Another key symptom to watch out for is breast changes. Most of us know to check for lumps, but other changes, like dimpling of the skin, nipple discharge, or persistent pain, should also raise a red flag. While not every change is cancer, it's crucial to catch any abnormalities early. Regular self-exams and mammograms can be life-saving. Let's not forget shortness of breath. This can be a symptom of anxiety, sure, but it can also signal something much more serious, like a heart or lung issue. Women are often less likely than men to recognize the warning signs of a heart attack, and shortness of breath is one of them. If you find yourself out of breath after minimal effort, it's time to see a doctor. Persistent headaches are another symptom to pay attention to. While occasional headaches are common, chronic or severe headaches could point to migraines, high blood pressure, or even neurological issues. If headaches are disrupting your daily life or are accompanied by vision changes or dizziness, seek medical advice right away. Skin changes can also be a sign of deeper health problems. For example, dark patches of skin, especially around the neck or underarms, could indicate insulin resistance or diabetes. Similarly, new or changing moles should always be checked for skin cancer. Keeping an eye on your skin and consulting a dermatologist when needed is essential. Now let's talk about mental health. Symptoms like ongoing sadness, loss of interest in activities, or feelings of hopelessness might be signs of depression or anxiety. Mental health is just as important as physical health, and seeking help early can make a huge difference in your quality of life. Ladies, your health is your wealth. It's easy to get caught up in the hustle and bustle of daily life, but remember, you can't pour from an empty cup. Listening to your body and addressing symptoms early can save you from more serious issues down the line.